A secure dementia facility tried to stop the Chief Ombudsman inspecting their operation during the COVID lockdown, despite him having the legal right to. The Office of the Ombudsman scrutinised 6 secure dementia and psycho-geriatric facilities during the earlier COVID level 3 and 4 lockdowns in April and May to make sure measures to stop the spread of the virus weren't having a detrimental effect on the residents' treatment and conditions. On the whole, the report found the units they inspected were strongly committed to residents' welfare, but 4 recommendations and 21 suggestions have been made for improvements. Chief Ombudsman Judge Peter Boshier says not all aged care facilities rolled out the welcome mat.
One of the facilities was not at all happy with me entering, my staff, and sought legal advice at my request on the lawfulness of us entering. When, as I understand it, a QC advised the rest home owner that we were within our legal rights, the conversation then turned to more positive things. We did enter, we were welcomed, and we got there. So the process in the end was able to be dealt with amicably, but initially quite a bit of apprehension about the Ombudsman and our role.
Why wouldn't they want you in there?
I think that this is wholly new for the private sector in New Zealand. The Ombudsman's known well for the public service agencies such as prisons, mental health units. This is the first time, possibly, that I know of in the world where an Ombudsman's been designated by Parliament to go into private facilities, not owned by the state, but owned by others. And you can see that they wanted to test this fairly carefully because it's space they're not used to.
OK, so you did go in and you inspected these 6 facilities. Generally, you found that they were really committed to their residents and their residents' welfare. But still a few issues. Let's start with the bubble system. So, did the rest homes understand what a bubble system was, or were they breaching it?
They weren't wholly putting into practice what a bubble should be. We all heard that expression so much from the Prime Minister. I think we understood, most of us, what a bubble was meant to be. Bubbles weren't operating as well as they could have. Now, to give a reasonable context, we were positive and complimentary about the commitment that rest homes had to keep residents safe. This is very vulnerable stuff, and in some countries, such as Canada, there's been a disastrous situation in relation to COVID-19 and rest homes. So to be fair, New Zealand's done well, but we've recommended for the future, and that's the purpose of this report, it's to set up a platform for better practice for the future. We've recommended what really is a good bubble to be focused on and implemented.
So some staff at these secure dementia units were moving from one set of residents to another without wearing PPE?
Yes. Yes, that's correct. So PPE in the rest homes wasn't being used uniformly in all situations. That's permissible, of course, but in situations where a bubble was more amorphous than it should have been, we felt that situation should be clarified and made to operate much more clinically.
One incident which caught my attention for all the wrong reasons was the testing of one patient, which was of particular concern to you. Can you explain to me what happened in that situation?
Yes, I can. So it's really important in rest homes where after all, the public can't go in and visit and see that there is assurance that what's being done is being done in a dignified and reasonable fashion. We felt the way that one resident was being tested wasn't dignified. It had to do with the fact that the patient was being held, almost restrained, if you like, in a way that just to our inspectors didn't seem right. It didn't square with that notion of dignity that you should have in relation to an older person. We just didn't like what we saw.
So the person holding the resident was not a nurse or a medical person?
Correct. The person holding the resident's head was a maintenance worker. So not a clinician, but a maintenance worker.
Okay.
Now, I'm not necessarily critical of that. It's just that the more you're trained and the more experience you've got dealing with older people, you know how sensitive touching the head is and what dignity means to an older person. These are all things we'd like to feel rest homes continue to focus on and improve on.
So, contact with families being maintained during these lockdown levels of 3 and 4, a lot of that was done by technology. But what did that mean for residents' ability to have private conversations with their loved ones or family contacts and raise any issues?
Well, there are a number of things in that question that you've raised, and can I mention 3? The first is that we found that in the absence of physical contact, which of course level 4 really brought an end to, that most residents that we went into, most facilities, made a genuine effort to organise Zoom calls. We want to say that mostly contact was promoted and it was well done. But there are 2 things I do want to say. The first is that given no real huge contact, residents have to be given a clear ability to raise issues and make complaints. And we found that that needs to be improved. It needs to be worked on. The other thing that we didn't like was evidence of blanket policy that even residents entering palliative care, in other words, about to die, there was evidence of a blanket policy that no visits, notwithstanding, would be countenanced. Now, that can't be right from the point of view of humanity and the ability to look really hard at putting into place a protective mechanism so that dignity can be maintained in that situation. And I know these were unusual and stressful times, but I'd like to feel as we mature and we grow into this work that we will increase that aspect of reasonableness, fairness and dignity.
So, Judge, you're basically saying there always needs to be an exception to the rule, then?
I'm saying that as a matter, and that's my job here in this office is fairness and reasonableness. Where you have a blanket rule and no ability to exercise discretion, I find that to be contrary to what Parliament's placed me here for, and that is to make sure that everyone is treated with fairness. The problem about a blanket no discretion rule is it can be very unkind and very unfair.
And that's the Chief Ombudsman, Judge Peter Boshier.